Good morning.
This meeting is being recorded.
Great to have everyone here today. So I know most people probably know each other, but if you could just type in the chat what agency you're from today, that would be great. My name is Aisha Moore, and I am one of the co-leads for the Strength System. I always forget what it is. All of these acronyms for the Strengthening Systems of Care for people with HIV and opioid use disorder. And today we are joining the Rhode Island Department of Behavioral Health Care, Developmental Disabilities and Hospitals, and the Executive Office of Health and Human Services to learn how HIV and behavioral health staff can apply the 8 dimensions of wellness framework to improve anyone's journey in recovery from an illness or condition. So right now, I'd like to just turn it over to Paul Oberti to give us a few remarks.
Thank you so much, Aisha, and the team from JSI for pulling this together. We appreciate it. I want to welcome Dr. Peggy Swarbrick. Dr. Peggy is someone that we've been working a lot with lately because we really believe in her concepts around the 8 dimensions of wellness and many other things that she'll talk about today. We thought this would be an opportunity to continue to use Dr. Swarbrick's talents so that we could envelop some of the elements that you do on a daily basis as either case managers or clinicians, people that are working with those living with HIV really confront a lot of serious issues that surface. I call them polymorbidities and polyconditions. And that is just basically a summary for, oh my goodness, we have a lot on our plate here. And so our goal as the executive office and as Medicaid, and by the way, if you don't know me, I'm the director of the HIV Provision of Care and Special Populations Unit. I'm also a medical administrator in Medicaid. And so we work with not only people living with HIV, people with hepatitis, and people with people in special populations, LGBT, people aging with HIV, for example. So today's purpose is to really have Peggy integrate some of her concepts into care planning in a manner that you can operationalize. You can take it right to your clients and your patients. And so we've invited a myriad of different people to the table today, including some consumers with the Consumer Advisory Board. So we do hope that you participate. We have some breakout sessions planned later, and we hope that you ask questions because this is really scheduled for you. So have a good session, and we look forward to engaging in discussing with all of you.
All right, thank you, Paul. So I'd like to introduce our speaker and facilitator today. Dr. Peggy Swarbrick is Associate Director of the Center of Alcohol and Substance Use Studies and a research professor in the Applied Department of GSAPP. Peggy can tell us what that stands for at Rutgers University. And over her career has made contributions in the realms of occupational therapy, nursing, community behavioral health practice, and is the creator of the strength-based 8 dimensions of wellness model. So today, Dr. Swarbrick will present on how to create and implement holistic solutions using the 8 dimensions of wellness as an organizing framework to empower individuals and communities to create and adapt habits and routines that build resilience and positively impact recovery. Now I'll turn it over to Dr. Peggy Swarbrick.
Well, welcome. Thank you, Aisha. Thank you, Paul. Thank you, the team from Anna. I'm really glad to be back again to really help share with you today and have a presentation. But this is like a learning community in a sense, the way we want to structure today, whereby what we'll do is spend a little time, because the topic of understanding, assessment, and care planning in AD, which is our topic, spending a bit of time looking at the AD model, which many of you probably have some familiarity with or very familiar, a little bit, it's going to probably be in the, probably hopefully a lot. Maybe you could post into the chat what's your experience, high, medium, low with the wellness dimensions. Go over a little bit of the framework, but then start to look at how it really has been used or can be used by you in your assessment process, treatment planning. And then most important, it's a we thing. Wellness is a we thing. So it's for us, and it's also for people we serve. So we'll look also at how it's something we can use for our own, building our own stress management, resilience, preventing the burnout, which probably many people are encountering in their workplaces and spaces and life, and how we can use it ourselves. We'll spend a little time on that. And we'll also then, we will be able to see how to really use it in your process. So that's really our game plan, is go over the wellness in 8D, see how it can be used as a tool, and then see how you can use it to strengthen your own wellness, self-care, and also for using it for others. So again, now I'm going to put the slides up in a minute, but the way we'll do it is I have information, we'll present, post in the chat. I have a lot of engagement in this process, so please get your coffee, but watch the chat, and you're going to learn so much from each other in the chat. And then when we have dialogues, like that's going to be really the learning, hearing a little bit of me, but a lot of you is going to be what you're going to really pull away from sharing your ideas and learning from your colleagues that are here this morning. So we'll spend the time presenting, engaging in that, and then we'll be breaking up twice during the period in between the presentations in breakout. So be sure that you're ready. If you need technical assistance in getting in the breakout, just let us know, because the breakout is where you're going to be able to be with a very smaller group to really dive in deeply to some dialogue around questions and exploration of applying this both personally and professionally. So that's really just wanting to give a little bit of an orientation for the morning and the way we're going to structure this, and also just get everybody's heads up. So I think, is there anything we want to say about that, Aisha or Anna, about getting people ready for that chat or for that breakout? People need help there. See, Anna has a question, some feedback there, just to get everybody oriented.
Yeah, we're just, for those from APRI, there's like 8 different Anthony's. So we're just trying to figure out who is who so we can document participation. So if you're able to just click the ... on the top right corner of your little video square, you should be able to rename yourself.
Yeah.
And if you're having any issues, just chat me.
Sorry, I apologize for that. This is the real
okay.
Anthony Facenda. I forwarded the link, so if my
No,
staff
that's
could,
great. We're so glad that
Fantastic.
now we got 8 people instead of just one Anthony. So
it's
that's
a little
good.
alarming to see all my names everywhere. But yeah, if my
They
staff could
cloned
just,
you, Anthony.
Yeah.
That's what they did.
Wonderful.
yeah, if my staff could just rename themselves. So yeah, go to the top right corner, click on the 3 dots, and then just put in your name, please. Thanks.
Yeah, so we know everyone, because we'll be dialoguing. They want to give you the credit for being here today and participating. So pretty much, let's get started. As you've heard a little bit about the topic of today, understanding assessment and care planning in 8D is our topic, and we're going to really dive into this idea of the 8 dimensions and learning about, as mentioned here, just a little bit. Again, it was mentioned about my work. I've been working over 25 years in a peer-led organization. What I always like to just mention that, because I've been really, I'm like a in-between bridger person. I do a lot of work in the community in this peer organization where really where I developed and I had previously developed prior to coming here, the 8D model, but it really became born and it grows and it evolves in a lot of the work at a peer-led organization, collaborative support programs in New Jersey, which we do a lot of community work. And then I also work in the university. I like to keep that balance between the two, because I think being on the street, being with people is so important, if especially if we're doing research or program development in academic spaces. So here's a way you can contact me if you need to follow up, and you'll be able to get this information. Again, this model came through decades of work, which I'll highlight as I go over that, or you may have here. So we're going to review a tool that you can use, or ways you can think about the tools you're already using that use the lens of wellness, get a deeper understanding of the wellness, and really think about it for yourself and how to effectively support others. And then just start to really think about the resources that are available and the strategies you can use for the assessment, and or how to incorporate the dimensions more in care planning process. but also show you, which I'll highlight a bit, is how the 8-dimensional framework aligns with the social determinants of health. So many of the factors related to poverty, social isolation, access to health care, trauma, discrimination, all the factors in terms of this, what we talk about, social determinants of health, food insecurity. That's really where the model of wellness has been really nice, because it helps us to keep the lens on those areas for people. So wanted to just highlight that, and that's sort of where we are. So this is where we'll go. We'll see what we did. So wellness is important, again, for, it's not just this population, that group. It's a real idea, wellness, not illness, wellness, moving that trans. So with HIV and other medical health challenges, it can fit nicely, as we're going to see, with mental health and substance use challenges. There's a lot of, there has been many examples of where it's been implemented, and it has a really nice place there. And also, I think from a prevention perspective, the stress, the strain, the burnout of the workforce, I've been using the model for decades with the workforce in a modest way, but it's become, since the pandemic, it just became very being seen as really a good framework for helping the workforce. And I also have some workforce things I can share as other resources if you want to use that more in your own workforce development or team development or supervision. But it's important for many people. So when we think about addiction, mental health, HIV, medical issues we're dealing with, there's always the prevention space, the treatment space, and then the recovery support space. And I think the nice thing about wellness is it fits in all of those spaces. There's a way we can use it from a prevention lens, from a treatment lens, and also for the ongoing support. So that's definitely what I wanted to highlight just as one point about the wellness model, that it's not just a spa thing, eating carrot sticks, going to the gym. People think of wellness as this fancy thing that we can never get, or wellness the way we're doing it. It's a lens, it's a vision of you that we want to bring to ourselves, and it's way more beyond the physical or the spiritual. Those are important components. But the disparities that I mentioned are really where I think I personally used it myself, this model, and also have then started to bring it into my work and have expanded into populations, because it really helps put us awareness on some of the disparities. And probably all of these disparities, these issues are influenced in your work. You know, people's lifespan are impacted, quality of life, years lived, impacted. Healthcare access, that's something you're doing and helping to bridge, but many of the people you're working had long histories of not having that good quality, timely access to care. The stress of life and the issues of poverty, unemployment, underemployment, incarceration really affect the stress of people. And again, that's really influencing sometimes the healing, the treatment that people do, that deal with. And it also creates this challenge for people. Not only they have HIV or substance use challenges or mental health, it becomes this storm of a trifecta of things, and maybe even more, that really influences the person in a way that might influence their healing, their treatment, and their living their life in the way they want. Also, people have health habits that often are influencing their health and their well-being, that get in a way. And then truly the social isolation, trauma, stigma, and discrimination that so many people you deal with, that's a big piece that I'm sure we can have go over. Many of these issues are things that people are all facing in many of the work you probably do. And so that's really where the social determinant health fact, we bring in that whole lens. It's been a much more in the field of behavioral health, HIV, mental health. We're starting to see, okay, not only the symptoms of the issues, but we need to understand the contextual factors of people. These things that determine health, these things that influence the quality of life people and or the lifespan of people, and the way we can design and deliver treatment. All of these issues kind of related to those disparities and even more are probably issues that are facing people that are getting in the way and causing stress for people, causing the influencing their ability to access quality, timely treatment and or want the treatment and be able to do the things they need to do to manage themselves. So we have to keep our we can't solve all these problems. We're not suggesting the wellness framework allows you to solve all these problems, but it helps us to give the lens. So when we're helping a person, we can start to target things and then try to empower people in ways and or develop access to other community resources, other resources that can be helpful for people. So thinking about the wellness model, it really helps us to think about, I see the dimensions really align well with the social determinants of health, that it can help us to be perhaps more effective in our assessment and hopefully much more effective in our care planning or our recovery planning. So wellness becomes what I call the lens, like so we can start to focus. We do long biopsychosocials. We have a framework of deep working with people, but I like us to look carefully at the details of the wellness, the physical, spiritual, social, intellectual, occupational, environmental, all the areas. It's a lens that we can view people that we're serving, so we can start to see some of their strengths, see some of their needs, and then see some of the opportunities of where we can integrate it into our care planning or access other resources or do advocacy. That's another piece we do. We have to do advocacy when we can't do something or we're hitting a wall. We may need to do advocacy. So that's really why wellness becomes this lens for the individual. Supporters need it, you need it, the supporters of people you're working with, and it becomes a good way to view the community, our community's wellness. And again, there's some good examples of integrating this with the Imani program that some of you might know about. We're really involving with the communities and working with the faith communities. It's a model that's been really using much more. And I just think it's so important. And I think it's great you're all here today and thinking about this or bringing it back. So I see wellness as like a conscious, deliberate process where we become aware of and make a choice. And that's for us. And it's also for the people we work with. So thinking about that, about our lifestyle, it's about day to day. What am I doing each day? What are the choices I'm making? And as you see and do this for yourself, you see you are doing things. The nice thing I liked about wellness when I started to really adopt this and explore it and try to find about it, it's not that it's the absence of stress, illness, or disease. It's the presence of having that purpose in life. And that's really what a lot of your work does, is you help people gain that purpose in life, have meaning and purpose in taking care of themselves, to do the other things, to have that active involvement in other things in their life, to have relationships and connections, to have a healthy body and a living environment, thinking about that environmental factor. And it's interesting, when I was first trying to learn about wellness and things and, research it, this was one of the biggest resources I kept coming up with, Dr. Halbert Dunn, back around a few years before I was born. I'm about this age almost. And also it was this doctor talking about high level wellness for the communities, like really for 60 years ago, thinking about this wellness for communities, like from the prevention model. And again, some of the work that has come about after Dr. Dunn and some others really is so, I love that it's not just like absence of illness, but it's the presence, and it helps brings that framework. And again, I like to think about trying to keep it simple and thinking about ABCs of wellness, having the attitude, the view each day. When I get in, put my feet in the ground in the morning, how do Peggy think about what she's going to do and know those things that I can do to keep myself in that balance, start to face the stress. I know what I need to do. Keeping a good sleep, as I'll mention in a minute, is a thing for me, getting the sleep. Whatever our go-to habit is, being aware of that and doing that. And then having the balance is another thing, because everybody thinks, oh, I need to have all these dimensions perfect. That's not the purpose of this model. It's to be aware of what you're doing, focus on it, and then try to activate doing that on a regular basis, and then understanding where the senses of imbalances are, and getting some support or resources to be able to do things in those areas, or find, like I said, the advocacy, finding someone to help me and advocate, and maybe we as a community try to make sure needs are met. And then really a big piece is understanding the control. There's limits to what we can change in ourselves or what we can access. So understanding that serenity statement is a big piece of using wellness, because that can be an area. So it's the ABC. So we encourage you, this is an inventory that will be, I believe, let me see if I can put that in the this inventory here is something that I'm going to be like moving forward, but I would encourage you that you may have taken it before, but it's a way. And this is an assessment tool you can use, right? Like this is a tool you can integrate into your planning, into the exploring what people need, and then integrate it into the care planning. Gives you a chance to look at your typical day and week and what you want to strengthen or improve. 2 special words. Strengthen, what I'm going to strengthen, or improve if I want to make it better, not what the problem I have. So again, the language of wellness is that we build on the strengths, we can improve things, and it doesn't go to that negative. So what we think about is, as I go through this, to just give us a little reminder, you have strengths and you have wellness habits. Do build wellness habits. And I think about that, even for many years, seeing how people will find that thing that they need to do from physical dimension, social dimension, spirit dimension, that activity they do. Is that what often keeps things going and then helps deal with the challenges that are often faces? So what I'm going to invite you as I go through this refresher, probably for you, you can go on to the survey, but I'm going to do a little refresher. What are the dimensions of wellness? Thinking about that, and pop into the chat. What is it you're doing day to day? Like, what are the things you're doing? So thinking about the 8 Ds and those physical activity, nutrition, sleep, activities to manage stress, accessing preventive and regular healthcare. Like these are just areas. And there's probably more for physical wellness, but when we think about a definition, are you doing physical activities? Are you refraining from chemicals that perhaps might be influencing you? Not using substances that are, or medications that are prescribed, getting enough sleep each day. These are some of the indicators, not to say you're perfect wellness, but these are some of the things that people do or will mark that they're doing often that can really help. Feeling rested, watching what you're consuming, doing good dental care, doing activities that help relax or help people with stress. Being able to think about those activities that support your strength, not balance. So thinking about the physical activities you do each day or week, and basically thinking about how all of that can affect the other dimensions, right? When I do something physically, when my sleep is better, in a sense, how does that affect me spiritually, socially, and emotionally? It has a much more positive effect when I pay attention to that. And each of you may have things you do that when that's a little off, it affects these other dimensions, but when it's on, it's really strengthening your mind, body, as Paul said, mind, body, spirit, and it's making you feel more activated in those areas and better, connecting and communicating better with people, feeling your sense of purpose. So you want to be thinking about those things and seeing how they affect each other. Again, getting sleep, a big one. Getting your rhythm is a big one. We can go into a whole piece on that just sleep and helping people with sleep and doing activities that match your rhythm can be a big piece of your case management assessment with people and treatment with people to get that rhythm and that routine for people. And then also just helping people with stress relief areas is a way you could assess and perhaps help people to manage developing care plans around their stress managing, helping them to unwind, teaching breathing of people, doing some physical activity. Even as you see, stress reduction only doesn't go to physical, there's the connecting with others. So that's where you're seeing the intersexual connections between the physical and the social dimensions. So it's just thinking about these various areas, especially for work in HIV, as well as with COVID and other kind of things. You want to be thinking about also immune system, physical dimension. What can we do for our wellness? These are simple things that are sometimes seem simple, but can be hard. Again, food insecurity, getting good access to healthy foods, could be an area you assess, and you might be able to help people to doing care planning about helping them to access getting better, vaccines for people, working through some of that, helping people cut back or quit smoking, doing regular hand work, and again, sleeping and things. So physical dimension's a big one. And like I said, I'm walking through each of these just to give us a little bit of a thought on what it is, start to think about assessment in this area and or care planning. But I invite you to even write for yourself in the chat right now, thinking about the physical dimension. What is it you do each day or most days for your physical wellness? In the chat, what is it you're doing most days or for your physical wellness? Love to hear each day or most days. What is it, that go-to thing you do? Getting at least 30 to 45 minutes of physical activity. Excellent. Walks in the evening. Wonderful. Yeah, walking has become people say walking, that can't do much, but yeah, we see it can do a lot for you. Yoga and Pilates. Excellent. Again, I love these hearing from you. So please share walking, because I learn a lot myself, and I've tried over decades some of the things people have shared, and yoga and Pilates was one that took me 7 or 8 years to go and try, and I love it now. Driving in a small town by the ocean, nice. Take that ride, hiking, walking. So what you do each day or most days for your wellness, go get in the sun in your eyes, stop by the ocean. After your second job, go to the gym. Excellent. Gardening, walking, water, hydration, really important to nourish ourselves and hydrate ourselves. Excellent, especially the work we do. We sometimes forget that we're on the road or we're on the computer for hours. Great. Thank you so much for sharing those. But again, we'll keep sharing those because it's good to hear what people are doing. You're doing things already. So having the dialogue with your people you see you're working with is an important thing, and having the dialogue and find out what they're doing for their physical wellness. And as we go around the wheel, it's a conversation you can use in the assessment process. And I'll give you a tool that might make it simple. We're going to do this in this presentation, but I'll give you a simple tool you can use for that. Great. People have lots of things with the meditation, taking showers. I love this. Really kind of hearing all the different things. Flowers in the garden, great. Yeah, fishing, it's really just all kinds of things, what you do, sharing it, and then finding out what people do, really, really important. So, and there's not like, no, that's not a physical dimension. Wellness is self-defined. So be mindful what one person has as a physical dimension activity might also affect their social and emotional. So be aware of that, the relationship between them. So intellectual, it's not that I got degrees or you have to go to school. It's about using your creative abilities, finding ways to expand your knowledge and skills. That's the way we see intellectual wellness. And thinking about intellectual wellness, again, we all have creativity. It's doing mental activities, something that stimulates, could be puzzles, could be something simple. Trying to see more than one side of an issue, very important. That's a source of stress for many people, having to convince other people of their being right or wrong, rather than trying to understand another perspective that may be different. Engaging in intellectual discussions, finding information, seeking new learning, especially when you're dealing with a health issue, learning that. And that's a great way of assessing that, and then helping people within the care planning about learning more about what they can do to empower themselves, take care of themselves, and accomplish their goals. Learning new skills, learning how to ask questions and find things, especially working with healthcare providers, which is probably a big piece of what you do. So today we're activating our intellectual wellness, being in a workshop together, learning with each other, but it could be libraries, but it could be crafts or hobbies, many different things that people identify as it. And again, learning from others, learning how to be able to connect with other people from other things. And then again, music can be a way for intellectual wellness, creativity, be a big piece. So just think about all those, and then we'd love to hear from you. What is it you do for each day or most days for your intellectual wellness? So let's hear that. We see sleep is a good one for the physical. Yeah, so reading before going to bed, excellent. Yeah, reading before, just spending that time, focused reading. Excellent. Love to see more reading, creative writing, puzzles. Wonderful. Yeah, the puzzles is good. Writing, gym, so that physical activity that, yeah, for me, walking does a thing for my intellectual wellness and gets my thinking going. Or reading and drawing, photography from various angles. Wonderful. Excellent. Love to see. What are we doing each day, or most days? Reading, music, walking. Excellent. Avid documentary watcher. Yeah, watching things, learning, growing, finding different kinds of ways. Music. Yeah, just turning that music on, having that can just change the brain chemistry and really bring us into a new emotional and physical way. Music, podcast is listening to the news. Reading, building Legos, playing, using creativity. Very, very important. Like that fun, we lose that fun, and when we get older we can't have fun, but we fun things, creative kind of things, really, really important. I'll even that over to the left of the of this little egg-shaped thing was something I made in the 80s. It was a little creative thing. I was like a big craft kind of person, and when I was dealing with my craziness and crap in that time, which was from about the 70s to the 90s for me, I got into these kind of things of making things. It like got all my anger, it got all my frustration, it got all my, and it created things. I just put that there to share, but we all have different creative abilities. And I did a lot with making, became like Barbie clothes, making Barbie clothes out of knitting for my nieces at the days. And just, you do something like just to help you, whatever it was. Don't ask me to do that today, but back then I had tons of that I was doing. But it was a creative way when I was in a lot of pain and needed to do something, and then a product came out of it, right? And then there's all that other benefit to it. So just think about those things. I love that, drawing and painting. Yes. So we're just going to walk around it because I want to share it, and then we're going to do a little bit more about how you really are assessing this already. Environmental, the supportive, and stimulating environments, the environments, the places and spaces that we occupy, our home, our work, our treatment settings. There's all different kind of places, but where is the safe places that support us? We feel safe, we're stimulated. So thinking about, the kind of, safety in our environments, that's probably something you're dealing with, many people you're working with. Going to places that are peaceful, or again, you might be working with people who are in places and spaces that are not so peaceful, so you might have to help them to find ways in their days to maybe be in a peaceful or calming place for part of the day to get away from the stress and the strain, helping people to feel safe in their living, learning, and working environment. And again, cleanliness is a very perceptual thing. What's cleanliness or clean or not cluttered to one person can be very different, but helping the person to get something that feels good for them. Many people need a lot more. Some people need to have more of a sparsely sparse place. I'm more of a kind of in between that, using natural light and keeping environment clean, really important. And again, I want to hear from you. What is it that you do each day, or most days, for your environmental wellness? What are the kind of things you actually do on a day or most days for your environmental wellness? Is it going out to places? It's doing something in your home environment or your work environment? We'd love to hear from you. What do you do on most days for your environmental wellness? So post in the chat. Love to hear. I'd like to walk out Friday evening after work. You enjoy a clean and organized space while enjoying the weekend. I always try to make your bed each day. Yeah, that act of making the bed for some people talks about, they'll say, when they're not feeling well, they know it's a sign of it isn't the bed or something in the room or the kitchen's not different. These are ways you can help people to be aware of and understand their own triggers and stressors, or when things are starting to break down. Clean and organized environment, plants in the home, purchasing flowers, excellent. Those are nice. Keeping home and decluttered and a minimalistic. Yeah. I'm keeping space organized. Excellent. Love to walking by the beach. I'm also having the flowers. So what is it? And again, these are all personal, different. Everyone has different preferences, but these might be things to be talking about with people. What is it that's going to be in the space, in the places where people you're working with, to keep that environmental wellness being in a good balance? sitting on the porch, smelling, hearing, and feeling the environment, saying good morning to individuals walking by. So again, you see how it interrelates with other dimensions in a positive. Cleaning the house before going to the for the evening, retiring in the evening. Excellent. It's, it's the places and spaces that we occupy and how we can, again, go back to the ABCs, what we can control and what we can put into our environments or do. Opening the windows to let the fresh air in. Again, excellent. Eating your meal out on the porch out there, leaving the morning with the house tidy and carrying your vegetable garden. So just, you're all doing amazing things. And these are so important things for our balance, our self-care, and to know you are already doing a lot for your wellness in so many of these different dimensions. The next one is the emotional dimension, a big piece of our work, helping people with stress, creating satisfying relationships. And this one, I think, is the one you might help, you might see a lot with people and helping people with, but helping people to think again, to use those things that help with coping with stress, tensions, again, going into connection with that intellectual example, the hobbies or leisure pursuits that we have, and thinking about what we do. Somebody talked about fishing. Some people see fishing also as emotional release, recognizing and expressing feelings, having those opportunities, as well as seeing challenges or problems as opportunities to growth, and seeing that again, it's shifting that lens. What is it we're doing, and how are we assessing ourselves, or how are we assessing and helping to explore this? Laughing, laughter is just powerful healer for so many people that can activate the immune system and really be strengthen the treatment that many people have by being so positive of that release that it can help physiologically. I'm dealing with stress and tension, doing activities that help you increase your emotional wellness, feeling good, expressing yourself, and also things that you feel about control. Again, these kind of are many things with emotional wellness that you can be thinking about, and just recognizing and learning about how to adjust and cope. Very, very important for the work that you're doing. What are you doing most days for your emotional wellness? Love to hear what you are doing already for your emotional wellness. I love this. Trying to keep fun in your home and work by laughing and joking with others. It's just so important. Positive affirmations, self check-ins, unplugging. Yes, unplugging. That was back in the physical dimension example, but it fits the emotional. They kind of interact. Meditation, good crying last night, having that that release. What are we doing to release? Crying, or some of the what we might say, oh, that's negative, but it's it can be a positive release for everyone. Biweekly therapy to decompress. Excellent. Open and honest conversations. You see where the emotional dimension has that intersection with the social component. So important. Waking up to an open heart and grateful for another day. Just really waking up and having that reflection, that simple reflection for yourself, thinking about that. Excellent. I love to, keeping to here, want to just work on the dimensions, get us a sense so we can start to then dive into how do we go in and assess people. Laughing, deep breathing, spending time alone, starting the day to talking and checking with supervisor about work and self-care, and or thereof, lack of, right? If you're talking with the supervisor, get guidance around that, and it can help guide the day rather than going by a month or 3 months and then you're really stressed and you have to take off. Excellent. Doing these things on a day-to-day basis. Financials, another one, it's, thinking about satisfaction with current or future situations. And it's just really this idea of looking at handling on, do we even have a handle on it? It might not be perfect or not, but do I have a handle on it? Can I meet my current expenses? Probably a lot of where a lot of your work comes in about helping people with financial things to help them, but just helping people to get some control over that, making educated decisions about make the choices. This is a big probably area where people are hit hard in the pocket today, but it's a thing that we want to think about, how you can help people to just gain that control over it and start to make some choices and supports around what you can do, having banking, things like that. This is a big one. People say, well, we can't help people. People are poor. People don't have resources, but you actually can. And if you're interested in any kind of financial wellness, we're actually currently doing a randomized control study of a peer-led financial wellness curriculum that we've done. It's available publicly. Maybe we can, I'll post it in the, make myself a note and send that out, because it's a nice curriculum that, case managers or peer supporters could use. It's been so well received. You can't even believe, I just got a email from one of the participants, this fellow that had been homeless, had like how he's accomplished his goals and some of the things he's accomplished yesterday, gave me this email that I just was ready to cry, of wonderful happiness for him taking this curriculum and how it's helped him move in his recovery also, and just to hear what he's accomplished. And he was, when he was even he was out on the streets, he participated, he got connected to Zoom, and we got him on into the course. And and I can tell you more stories like that, but it definitely, financial wellness is, we can help people build some areas in that, and it really transforms people's life. I love that people talk some more things about the songs, music, kind of related to the others I see in the chat. Really great chats. We'll want to save them and share them with everyone. Social, the sense of belonging and support system, really thinking about, this is a big piece of your work, right? This is the core of your work. What you're doing, then, is thinking about that. And so really thinking about the work you do is so important for people you serve. And again, then it's making sure you have that support for yourself. You provide, do we have people who can provide that practical support or that emotional support? Do we have that sense of community or sense of ability to communicate with other people? Thinking about that, helping others when you can, and knowing the boundaries. And I think also one of the things with social wellness, again, you're doing a lot for people already, and thinking about giving compliments to one another. Social, that can be a thing to be mindful and supportive of the people you serve, but also get it for yourself and get it for colleagues. When we think about this being a we thing, that compassion that we have, and trying to balance our needs with the needs of others, being more in line with that. And we have puppies here. We had a nice puppy conversation. Puppies can be a nice social wellness for people, and cats too, and maybe even fish, right? What are the social connections you have? And that doesn't have to just be people. Some people have animals or things that are really powerful connections, social support systems for them. And being aware of that could be something you might be helping us person with, is trying to help people with those areas, and then also helping people to learn from others or getting along with others is a big piece of social wellness that we don't think about sometimes. But it doesn't only just be us in our work, we give that social support, but it's about other ways we can, and other ways we can get reach out and learn and meet new people and learn, build our systems. And I did want to highlight, just because of the work we're doing, high social connection. Social connection is so powerful for our work, immune system, right? Our immune health, which we really have become so, in HIV work, this already, but as with the new last 2 years, we're so aware more about immune health. Social connection is essential. So your work is a powerful tool in helping people quality of life and lifespan. Just know that you're really having a big piece. So helping people with that connection you have with them, but helping them to build it. It can help them emotionally. It can help them, with emotional regulation, depression, anxiety. It really helps people in so many ways. A lot of good research on this. And I direct you to the Center for Compassion and Altruistic Research and Education. I got this slide from it, but as I research more to find what's the evidence behind these dimensional areas, this is a powerful one. Social, it also kind of, like I said, relates to the physical dimension. So as we roll around the wheel, and then we're going to move in, you're doing a lot probably already in your social dimension. That's 2 more, and then we're going to kind of take a little time to do an activity, and then also just kind of talk about how this relates to your assessment. Spiritual, this is one that gets tricky. It's about the values, beliefs, and sense of purpose and meaning in life. What are we doing that aligns with our values? What are our beliefs, and are we doing things that are aligning there? And do we have that sense of purpose and meaning in life? So are we reflecting on our personal values and beliefs on a regular basis and taking that time so environmental spaces and places can help facilitate that for ourselves? But are we doing that on a regular basis? That's important, because a lot of times when we're doing things that are not aligned or clashing, that can be a source of stress. The gratitude, having the gratitude, many of you talked about that, doing that, being grateful, taking that time, participating in a spiritual activity that's self-defined. This is where we have to be careful of our own. What is our spiritual activity and how it might be similar or different than others? This is where we can get into trouble sometimes when we think, well, if they just went to church and they just accepted God, or sometimes people have these beliefs that we want to impose onto others. We have to be careful, because that's not perhaps the belief of that other person. So you have to kind of really look at the spiritual one very clearly where you're at, and know that it's very personally defined, all these wellness areas and activities. So be mindful that your spiritual activities or your spiritual definition may not be the same as another's, and you're both right. You are both right, because it's your definition, it's your activity. But in our encounter of as a supporter or a case manager or worker, professional, we have to respect where that person is and know where what ours are and what are the person's defining for themselves. So be mindful of that, because we've in my work over the years, people have been challenged by this one. But I also know that people have been so grateful that especially the behavioral health system is not pathologizing the spiritual dimension, which we actually did for years. When I used to work in the state psychiatric hospital, someone would be talking about some religious thing that we didn't understand, or they were going on and what we perceived as on and on and on about it. We gave them Haldol. We just piled them with Haldol or some high medication that would knock them out. And rather than understand that they were under stress and strain, and that was their coping, was to be talking a lot about this thing that was troubling them. So it was understanding that, not medicated. So be mindful of that. Spiritual can be tricky, but it's such a powerful one that can really be so important, especially listening to inspiring messages, as having that sense of purpose each day, but finding those ways. So again, thinking about that gratitude we have in life and thinking about having that hope is a big piece. So feeling gratitude, listening to inspiring messages. So the last one, which we'll talk about, is the occupational. And it's, again, not just work. It's not just, it's volunteer. It's that purpose and meaning, doing those things each day that use your strengths, that are consistent with your values and interests. And it's about how you're spending your time and thinking about what you're doing each day that you personally feel, or the person you're working feels productive. Again, and a lot of times when you're helping people in their recovery, a lot of their self-care becomes the work of the person. So validate that they're doing hard work in their occupational wellness, because they're taking care of themselves, right? They're doing things, they're planning their care and doing the things. They're spending their time to take care of themselves. And then maybe as they feel better, we help them to do other things. So be mindful of that. Thinking about with occupational, it's the balance between these activities as well, and thinking about how you're spending your time, and having that good enough time alone, not feeling isolated. It's having that balance, but it's having that structure, and also thinking about what brings purpose to you in each day. So this was, the occupational is not just the work, though I have a lot of work examples here, but it's so many more different things for people, and or you want to be able to help people. But it's, again, I love this, what you do each day, or most days. You can pop in the chat. It's that thing about the world needs it. You may be paid either monetary or emotionally or spiritually paid. There's this payment spiritually and emotionally you can get from doing something you have passion about, you're good at. And also you can be thinking about the, you like it and love it. Like, so we should be, it would be good. I don't want to say should. It would be good if a lot of things we're doing in the day is something we like to do, and have a balance of that. And I encourage you to think about that in your work with your supervisors, in your family compositions, and in your own life. Or am I spending things in the day? I'm doing that. I like that, really use my talents, use my skills, and that are consistent with my values. So I just wanted us to walk a little bit around the dimensions right now. That was just like an overview, get us our heads wrapped around it. And what we'll do is we'll spend a little time basically want to share in that we'll want to be going into some breakouts right now. And basically what we're going to talk to each other for about 10 minutes. You all had different things. Some of you might have had more things you wanted to add, but you're going to be in a breakout for about 10 minutes. And we want to share, what are your top 2 or 3 things that you do for yourself, for your wellness? If you think about all of the 8 dimensions we went over, and all of you were popping things in the chat, or maybe some of you were writing them down for yourself. Let's have a small group discussion to hear 10 minutes. Like, let's get everyone out there. What are the top 2 to 3 things? And we'll have that discussion. Then we're going to come back, and then we're going to move into some more focus on how to use the framework around assessment and care planning. So that's our next step, is the small groups. And it's basically top 2 to 3 things you're going to share in your small group of what activities you do for your wellness. It could be any of the 8 dimensions. So we'll be there for 10 minutes.
Okay, I'll open up the rooms.
Okay, so maybe maybe we could hear from each group. Maybe the other group. Paul, you want to share from your group, or we have a couple volunteers who are going to report from our group, but do you want to start, Paul, your group? Oh, they're not back
Oh,
yet.
they're not back.
Okay, they're not back. Oh, I didn't see that. Okay, we're back here. We got back.
There they are.
Deep into conversation, right? So you just hear a short, let's kind of, maybe we can get a snapshot of the conversation from your group, Paul, and maybe we have a few people who are going to report out from our group. So
great. Yeah, I had a hard time trying to record, but I did listen intently, and we did have a great discussion. There were some really, I'll start with the last point that Katie was making about incorporating reflections. And she did this as a result of some of the things she was doing with COVID, I understood. But nonetheless, at first, I think, Katie, without using the exact words you used, there was a level of resistance to creating reflections during the day. But then once you did it, you realized that there was some benefit to it, and that it was something that was really important. I mean, Scott mentioned something too that I thought was really great to share. Everybody said great things, but Scott talked about developing routines. And I liken that to some of the things we were doing in advanced digital technology, where people were building rituals. And I think rituals and routine building, and as Scott shared, really helped to kind of focus and get through the day. And sometimes when we were younger, at least I know, I was really resistant to developing routines. I thought, oh my goodness. Then when we had our daughter, my wife and I realized that you're dead without a routine. I mean, you're completely like fizzled out. So there were some really interesting components about routine. We talked about the other dimensions. I mean, Catherine spoke about the financial elements and just giving herself a bit of a check on things. Because, during COVID, we had some wonderful experiences with home shopping, didn't we? And, I know that Amazon is probably, I mean, I know why Jeff Bezos is rich, thanks to me. I mean, it's amazing, right? So just giving yourself a moment to reflect on the 8 dimensions and to really begin to have a solid sense of what they mean to you with intent and consciousness. And, like I said, when I get up in the morning and I develop my sense of who I am, we all sort of agree that that's a way to start the day in a way that allows you to go down a road that you feel comfortable with. And, you know, it's not like I wake up every morning and I go, oh, like, wait a minute, dimension number one, how am I doing? Dimension number two, there's an intuitive sense that you bring to yourself. I believe with age particularly, although there were some very young people that have this intuitive sense of really allowing themselves to be well and all that means. But as I got older, I realized that that consciousness really allowed me to see the things that were up next. So if it was financial, then I would deal with it in a way that was not a negative. It wasn't, oh my goodness gracious, I'm not going to be able to pay the rent this month. It was, I come from abundance. I know that sounds a little weird, but it changed my life when I realized that the concepts around how I approached what I was looking at really helped my sanity. So that's a little bit of what we said. I'm sorry I missed everybody's details, but gave you sampling.
No. Oh, no, thank you. If anybody else from the group wanted to add any more in, that would be fantastic. Just hearing from the group that, or your takeaway even from that small, that 10 minutes together. Maybe then we can hear Dalen or Deashur, both of you could share for us, and then I'll add in, or someone else. Deashur, you want to start off? You're on mute. Unmute.
As I'm speaking away. Sorry about that. But we covered quite a few of the dimensions. We looked at physical and how people, again, were taking care of themselves physically, which ultimately affects them mentally, emotionally, and every other category. We also talked about financial, not only planning, but planning with specific goals in mind. Some was saving for a house, other kind of financial goals. We had individuals talk about socially in terms of making that connection to their family and ensuring that they're spending family time together, doing different activities, particularly with the weather in mind. I'm thinking, summer, ensuring that they are going to cookouts and family gathering and fishing. And I also mentioned the environment with regards to light. Natural light is very important to me. It doesn't matter what the season is, that I'm always looking to wake up to that natural light and ensuring that I'm bringing it in every aspect of my home. In addition to having a list of things to do, that is kind of important that I look at how my day is going to flow. And I'm not only thinking about what I need to do, but I'm planning some downtime during the day, whether that's the time that I'm actually going to start in comparison to when I'm going to take a break, as well as when I'm going to close my day in terms of work. I had shared that I have a tendency to be a workaholic. So it's very important to me that I bring in that balance. In addition to that, I also start my morning off reflecting. And there are a group of relatives and friends that we text spiritual affirmations and inspirations. So that's always a great way for me to start the day with the natural light, thinking about gratitude and being very thankful for where I'm at, because things could always be worse in a matter of moments.
You really did a great job, Summer, and I loved the strategies of the writing down and the unplug planning to unplug. Excellent. Dalen, do you want to share the other pieces of what our group talked about?
Sure. Deashur covered a lot of it, and we did speak of just keeping certain physical goals. I know Anthony said he likes to keep 45 minutes to an hour of physical activity every day. I know Elsa goes to the gym, to keep that physical goal in mind. For myself, self-reflection is very big. It kind of covers the emotional and spiritual part of it. I reflect on myself and my actions, my thoughts, my speech, with others, make sure it keeps them in a line with my own code of ethics. Future planning with specific goals is great. I am saving for a house as well. And I really think that keeps you grounded and, keeps like in like any goal setting, it keeps you focusing towards, something that you need or something that you want.
Right.
And just confiding with loved ones, keeping that social aspect up and knowing the who you can confide in and who you cannot.
Yeah, that's it. That's really that social piece. Yeah, that's excellent. Yeah, no, we had a great group and it was we have a large group, so we had a lot of collective information there, but thank you everyone. Just I think the purpose of our first part was to wrap our heads around the dimensions, see it as the lens, so it becomes naturally more in our awareness, but it's, wellness, as I mentioned, being a conscious, deliberate process of becoming aware of and making choices where it will become automatically and it becomes a habit. Remember the slide I said, wellness habits build wellness habits. And again, we heard all of the many wellness habits you already have, they keep building. And then these are the areas, again, as we start to shift into assessment and care planning, how are we doing this with, this is the best gift you could do in your care planning is help people to develop those wellness habits for themselves. So the next piece we're going to move into is going to be a little bit more about the, I'm going to share a tool that I wanted to share that might be useful, and I'll send this as a thing. We're going to talk about care planning and then just what are ways you're doing that. We'll do an exercise to see where you're already assessing, and then we'll start to talk about some resources and ways you can help integrate this into your care planning process. So this, as we saw here, I want to highlight, this is a tool we just put together. This could be a tool for yourself or for people you work with. It's something you could use once you assess or it could be a tool you can just help gather information, is help people to create their own. I love this. We just created this little piece and people have been trying it out, but it kind of encompasses a lot of some of the things people talked about, like helping you to focus on those things. So it helps you to prioritize. I think that was a theme I saw. And then you can just kind of put your own dimensions. If, it doesn't have to be, we have 4 top ones, but if you want to change it to the other areas, but it just gives you a little bit of where to put your top 3 things as a reminder. You can do this on a daily basis. And then the sleep being important for so many people, if some people want to put that time in and time up. And then it gives you the ways that you might want to reflect into, what am I grateful for, and list that out, and or something for tomorrow. So I'm going to share this with everyone, but it's a tool you can use for yourself and you can tweak it if you want. But we found this has been helpful. A lot of us been using things like that. And we just tried to create this as something, and we're actually going to be posting this shortly on the website with 30 copies. So I'll send the one PDF for you now, but we'll be having that on the website. It's free, you can download it, but it's a nice tool to just show a way to start to, I love it with what some of you talked about. It's a nice tool, but it also helps, something you could actually help doing care planning with people you're working with, helping them to create this self-care plan. So it's good for yourself or others. So when are we talked about the dimensions. So where do we think about the needs assessment, care planning, direct support should be interventions or linking to resources. These are what you do in your work. And remember, it's the 8 dimensions, the social determinants of health. Using this lens, it just helps us move away from symptom reduction, moves to help rebuild resilience, and we can start to empower people more using this lens of wellness. And I do want to highlight, there are, because part of the tool is to think about what resources are out there, but from a social determinants of health, which I'm not going to go into a lot now because we're spoken more about the other 8 dimensions. Here's some tools that I'm going to be share. We're not going to go so much into these today, but they're going to be links to resources if you want to go in, dive into the social determinant of health assessment tools. Here's some nice tools from Center of Medicaid Services and helping people to understand some things around social determinants of health, food insecurities, transportation access, like subdivisions of the 8 dimensions that you can think about. So they're there and they're in the back of the PowerPoint as resources. I wanted to make sure it was a little more comprehensive beyond just the 8 dimensions. But so those are some resources. But when we think about the lens of the wellness dimensions, which we just went over, I'm also going to share this other tool, and this is just one tool, and then we're going to go into breakouts and see what tools you are using. But for you assessing people to be able to do care planning, this is a tool that we use that we just basically it's helping people do what we almost just did in the exercise, but you could do this one-on-one with people to ask them what they believe are their strengths. What are they currently doing each day or week for their overall wellness? So this is a new assessment. You could either add or you can integrate this into what you're already doing. And we'll move into the breakouts to see where this might nicely integrate in that. But it's a nice tool for really to sit down and have the conversation. What we just did together when we were doing the presentation, and then in your small groups, you'll sit down and walk through these with people to think about, what is it I do each day or week, and record it. Again, this is a nice way to sort of, we were talking in our group, to write it down is nice. And again, this tool is an iterative tool, like you use it over time. You can keep adding back to it. I'll send a copy of this to you all to have, to be able to use. But it's adding in the strengths. So talking about that, engaging and finding out what people are doing to perhaps inform what kind of care planning. Then you might want to move, once you've known all the 8 areas, what their strengths already are. You can then go to the next page that will say, okay, you're doing this already, but is there any area, and it may not be all areas that they have identified, where is it you want to improve? It might only be 1 area, it could be 2 areas, but you'll get a profile of people of what they are thinking, the areas they may want to improve in the different areas or strengthen in it. So it really helps to have a way to map out what's already happening and where you can start to help develop more specific care planning with people. Now, what might happen now is you might have a person put 3 or 4 areas, or they might put 8 areas, or they might put 2 areas. So you kind of say, okay, can we tackle all these at once, right? You'd be like, wow, they have all 8 areas. They want to do all these things. So what do we do in that situation when they have all of these areas they want to do? The next page basically helps you to start to help. Then once you look at what they wrote on the previous page here, you'll keep that in mind. You'll get them to do a level of importance scale, seeing what's important right now. What do they feel on the scale of 1 to 7 is more important right now? And then you, depending on your service delivery, say your time is 30 days, 60 days, 90 days, you have to figure out your context of your services. Ask that question. Okay, in the next 30 days or 60 days or 90 days, what's most important for you that you want to target this area? So you want to be thinking about what that is in the timing, and then understand that a little bit. And then you can ask some open-ended questions that are on this form, as it says below. What's most important to you and why? So we'll have some discussion about that. What might be less important, they have, so they can start to prioritize for themselves the area you're going to target in the care planning to help them. And then you want to think about much more about what is right now in the context, the 30 days, the 60 days, 9. So, and then just start to have questions about, okay, this is what you're thinking, using open-ended questions, reflective responses, and what's your confidence to make that step here. So it helps you to start to think about ways to narrow in the focus that the person wants to do. Seeing if there's any questions about this process so far. Let me see. Let's see. Any questions or comments before I move to before I move to the next? Yeah. Anything? Yeah. This seems like a tool that could be usable in your space of your care planning. Okay. And I'll go to the next session before, so it's the strengths, map them all out. And the nice thing about the strengths first page, it's going to help you with the plan. You use this you go back to it. This helps to narrow it down. And then the plan, then it starts to see the goal. Okay, once I decided what's most important, what's the goal? And again, most people use the SMART format. You might have another format. This says SMART format, but make it specific, make it measurable, make it achievable. And that's a dialogue with the person for them. By what date I'm going to be able to do, they're strengthening something or improving it. You use the language that's going to be something that they can observe, they think is important, something they think is accomplished. And it basically writing it down in the SMART format and having that dialogue to help them map it out, and then recording the goal really clearly. So it all really builds from each other. So you'll get the goal. And again, that's always in care planning. You have to have a goal, usually measurable. The next step in that process is once you get the goal, okay, how are we going to accomplish this goal? So it's, the goal is written there, and then you always want to have the reason for the goal, right? That's an important piece. So we add that as a step to remind us, why am I having this goal? So that came through a dialogue you already had. So you want to help the person to record it and write it down. You also want to help them think about what are the challenges they might encounter in accomplishing the goal, and what could we do about this challenge if we encounter this challenge or barrier is going to get in my way. So it starts to do problem solving. And as you set the plan out and you meet week to week, you could keep adding to this. This is a living, breathing document. It's not just a one and done. It lives, it breathes, and you add as you move along. So you may not see all the challenges the first 2 weeks, but by the third week you encountered a challenge, and then you brainstorm what you can do about it. What are the resources I need to accomplish this goal? So in your care, you're always doing that in care planning. You're ready. What are the resources? You're mapping it out as it relates to this specific goal. And then who are the supporters? What can I do as your supporters? And what are other supporters? And what we use in this framework also is what the supporters shouldn't do as well. Some people find people nag them. Some people do things that are nagging or perceived as a nag to them. So you want to be mindful not to do the nagging, because we often do the nagging not purposefully. We haven't had the conversation to know it was a nag. So it gets that conversation out there that the person can tell you something that they prefer, they don't prefer, you do or say, that it gets concretized, and then you're aware of that. So it's a nice way to really map that out to help think about what are the possible things that are going to get in the way, and start to brainstorm what we can do about it. And then you can just set out week to week. I mean, this is very, very, very detailed. Might not want to go into this detail, but we've found this really has worked. We've used this tool for a long time in this, what we call wellness coaching, and it's worked quite wonderfully in helping people, but it's a living, a breathing document. And you can start to help go week to week. And it also helps you develop ways to plan the next appointment, maybe having some accountability steps that you put in the way. But this is just a tool I wanted to share as an assessment, because that was what we wanted to see, how can we assess these 8 dimensions? And this is a tool, one of many tools. There's many other tools, but this was one I wanted to just suggest, review, and perhaps what we will do is spend a little time in our breakout thinking about that tool maybe as a possibility, or what you're already doing. We're going to have a little bit of a sharing in our groups, thinking about the framework, thinking about that tool I just shared with you, but also brainstorm what other tools you're using to assess the various dimensions, and using how you're using that to set the goal with people. This just gives you a structure, a process, but you might be doing something already. We want to hear that, and we want to share the good learning of what you're already doing. So we're going to go into the small breakouts, and so we're going to ask, and this time we'll be in smaller groups. So we're going to ask, when we get into the breakouts, you think about, share how you assess the dimensions and where and when you follow up with them on a goal. This was a structure for that, but tell us and discuss with each other how you are assessing the different dimensions together. And we'll want to hear from each of the groups. So we'll want to, maybe somebody take the notes in the group. You can decide at the beginning who wants to kind of record some of the notes, and then we'll hear together when we come back. And we'll be about will probably be about 10 will be about 12 minutes, I think, for this one. We'll be in about 12 minutes for this one. Okay, Anna, is that good? So see how the template, if you think the template could be used. So basically we want to share, go into our groups, and we'll come back and then we'll hear from everyone. Unless if there
Recorded.
So whose group wants to go first? We had a really lively discussion about how to use the potential template, and then people realizing they were collecting a lot of things already. Like to share.
Or I forget because we didn't choose anybody, so it's still fresh on my mind. But I think the one thing we talked about was just like the different roles in organizations and who's doing this kind of stuff. So like you have your intake person who's different from the case manager, right? And so it's like the intake person can ask some of these questions, but then the case manager that they then get assigned to over time is the person who's going to really assess these things and reassess them. And then when you think about all the different services an organization might have, like even thinking about embedding this all the way through. So if someone is encountering someone at that organization's food pantry, can that person also be asking, not formal assessing about wellness, but, talking about wellness in all the different places of the organization. So that's what I quickly remember. I don't know if anyone else from our group wants to add anything.
So maybe the idea of thinking about, okay, whose role is it, or how is it divided up between roles? And then how is everyone working from the same, literally same page? How is it more systematically from the same page, whether the clinician or this person, and maybe the case manager is the person who sort of helps keep it all together, like, or determine who that role would be. That's nice. That's a good thing to be thinking about. So everyone's sort of literally on that same page, and then everybody's collecting information in pockets and they can be shared collectively. Excellent. Maybe
I'll
more.
share from our group. Folks in our group felt overall they were incorporating the 8 dimensions into assessment and care planning, although not as focused and deliberate as using the templates. We had a great discussion about the self-care tool and using it for case managers themselves.
Excellent.
Because case managers often don't take care of themselves or think about self-care. And for example, John mentioned he'd like to use it as, he does talk about self-care and supervision, but would like to use the form as part of supervision with case managers. We also talked about, Peggy, your comment when you said assessment should be less about diagnosis and more about empowering our clients to help them become well. And, we kind of talked about how assessment does end up being just, fill in the blank, what is wrong. And we talked about doing more through care planning, more of that asking, what is your priority? What's important to you? What do you want to work on? And focus more on the strengths. Did I miss anything, guys?
I'm going to ask our group to go. I tried poorly to write some quick notes and I posted them. So, but I know that we had a lively discussion. A lot of the things that came up already are true, that there's been a lot of focus on wellness over the years, but the framework isn't as formalized. And people gave a thumbs up to the template. But if you guys want to talk in my group a little bit more about what you were sensing,
I can start. So we talked about care planning being very conversational and client-led. Make sure that it's being informed by the client, that it's like a living and breathing document. We're revising it. constantly reevaluating it. We also talked about goal setting and outcomes. So the importance of, setting some like short-term goals, intermediate goals, and then long-term goals. But those short-term goals could be like, easily attainable or reachable goals that clients can build upon. And then also using harm reduction, meeting the client where they are at that first meeting. So you're not coming up with, insurmountable goals. Paul brought up the example of, someone smokes 4 packs of cigarettes a day. Your goal isn't going to be to go cold turkey and just, cut out all cigarettes. Maybe it's smoking 1 less cigarette a day, that sort of thing. And just making sure the client is always being seen and heard every step of the way.
Yeah, I love that. And Dalen, I don't know if you could speak, but I love what you talked about. I just paraphrase what Dalen said. Clients need to be seen in the care plan, and wellness really plays into that. So sometimes we see care plans as a purposeful document that just gets recorded like an EHB, an electronic health record. And it's more than that. And I love what you said, Anthony, living document, breathing document. Dalen, I don't know if you want to expound upon what you said.
Yeah, absolutely. Just keeping it more relevant to the client. Don't use, language that they won't understand. They want to be seen and reflected in each goal and each service that's provided. Keep it relevant, and consistency. With that. So just make sure they're seen. If they don't feel they're reflected in the document, it's irrelevant. It's arbitrary. It's just another piece of paper that they're signing that they'll come back in 6 months and sign again. Working with people over the past 7 years, I've really, found a way to do that, to really incorporate them. Whether it's just simple stuff as just including, their providers, or just including, their housing situations, or including personal goals as well. Not only, goals that we're working on together, but something that they're working on, outside, just keeping it relevant to them.
Yeah. It reminds me too, Dalen, of, I talked about electronic medical records. It reminds me of what one of the clients said to me about how my physician never shares what they put in their record, but my case manager always does. And I thought, that's kind of neat, right? That there's this different sense about what it is the case manager does with a care plan versus what maybe a clinician might do with an electronic record. So it's kind of cool that these are different, and they are definitely leaning in towards the wellness mentality that you talked about. Anybody else from the group? And again, I tried to capture broadly what we talked about, so excuse my quick notes.
Well, with our group, and anybody else could share in, there was a bunch of discussion, some similarities to what we've heard already, where the idea that there's like a lot of information collected, as was said, in different spaces, but sometimes it's not in a cohesive place for everyone to know where it is, basically. So there is a lot of information, and again, like you said, different places, but there's also was a sense that there is actually collecting of data, of information around the dimensions, but it's not recorded. So it's not like more systematically put in. There's either actually hearing about these, learning about these things with people, but it's not like in a consistent way. So there was the sense that the template could help in some way, or some aspect of the template could help, or there could be more consciousness around sharing it in a more systematic way, because there was a sense that they're already knowing about financial and the different areas, and there was some discussion about that. People talked a lot about financial being a challenge for people, and a big area of challenge for people. And again, the other thing that was mentioned by, I think, more than one person, was like that we tending to focus on the goal, on the medical. It becomes very medically focused, whereas there might be an opportunity to focus on these other dimensions, maybe even to help in service of that medical focus goal, but maybe there's ways that there could be other types of goals and plans around the dimensions. And then there was also a little bit of discussion about the importance of writing it down and having it recorded and being on the same page with others, as well as developing trust. There was I don't, if anybody wants to share about how it takes time to develop the trust with people. So you can't barrage people at the beginning. And maybe some of these questions might help build some of the trust because they're not like so overwhelming for people. So that was a little bit what I caught, but I would love to hear if there's anybody else in our group that wants to bring in an angle that I missed. Scott, did you want to share anything?
You pretty much, you know, brought up what I had talked about is not accurately reflecting our conversations about the dimensions of wellness. I do believe, you know, I had mentioned we focus a lot on the demographic part, but if we are able to kind of transition to a more strengths-based, wellness-based type of discussion, I do believe, like you mentioned, that, you know, building a rapport with a client would be a little bit easier and it would make them feel more comfortable, and it would allow us to obtain some of that other information that we may need. But we, you know, being able to build that trust and getting to know them as a person, as a whole person before would allow us to do that at a better rate.
Great. Anthony. Anthony, had you do you have your hand up?
I think it's one of my staff, but not me.
Oh, okay. So, okay, someone,
Yeah, it's Semi.
okay, feel free. Yeah, go ahead.
Can you hear me?
Sure.
Okay. So what I would like to bring out is a very, I'm very interested in what this training. One is most of the time we take care of our clients, and we are too busy and we forget to take care of ourselves, and sometimes we are too exhausted, you know. And I think taking care, you try to explain many things that we need, even maybe physical, spiritual, and all those dimensions. I think it will help us to take care of ourselves and also to encourage our clients how to manage their strength and to be more happy for them. And also trusting, you just talk about trusting. You know, when we work with the clients, it takes time to get trusted by the relationship that we build with the clients. So to be trusted, to get them open, to create a kind of friendship with them, and they are more open when we are trusted with our clients. And but this, it takes also, it depends on how we build this relationship with our clients. So I have many clients, I've been working with them many years. Sometimes when I'm with them, they say, okay, Semi, I don't know if without you, what I was going to be. You are all I may need, because they are open. They feel that we are more than even their relatives, because we provide the services, and we this connection that we build with our clients, and also socializing with our clients. For me, I was very stressed in the period of COVID, because I could not meet with my client. I could not spend time with my client, but I think it's very important what we've been doing. And also, I just learned more, and also it's very interesting.
Yeah. Well, thank you. The self-care, you hit it home. It should take focusing on your own self-care. And I think one of the groups talked about that, using that tool are so important in developing that trust. And yeah, you are it. I mentioned that when I talked about the social dimension, you are a major player in people's life of that social connection. Remember the slide about the health benefits of social connection? You are a boost. You are providing an enhancement of their health by the social connection you have. So it's very powerful. So, you know, giving yourself a pat on the back for the amazing work you're doing of helping the quality of life for people's by that positive social support you're providing short-term and long-term for people. And so, yeah, no, I think
Vicky, I have a question.
Sure.
A logistical systems question. In our group, we talked about how organizations, agencies already have existing forms. They're already assessment tools and care planning tools. And some agencies are part of larger organizations, so it's hard to change those forms.
Yeah.
What suggestions do you have? Or what
Yeah.
have you seen other organizations do to, you know, move us more toward the kind of tools you've shared today?
Yeah, one of the things you could do, I would try to do a mapping, sit down with the tools and map the questions are ready to the dimensions, and maybe think about, just do that if you can, if you're in that leadership role or a team, do that. And then perhaps one of the things you're going to see, there's lots of redundancies. So maybe there's a way you can point some of that out to people, that there is some redundancies, to reduce the redundancies, because that's a huge problem. That's where staff get overwhelmed and people get overwhelmed, because you're asking the same question in 20 different ways, and then the information goes nowhere. So just do that mapping, and then perhaps make some slight suggestions to maybe a rework of that. But also you can figure out a way of what, you know, your existing care planning tool or your existing tool, you can see how elements of what I just showed you might fit. Where does it fit? And then I think that, I mean, there isn't usually a case management assessment tool. This might be a good new case, those of you who are case managers, or those of you who don't have a structured type tool and you're just existing from here, you might want to rethink this could be just a tool. Maybe it doesn't go in the record, but at least you start from ground right now, trying it. So again, I think there's a couple of the ways. It's mapping it, so you can do some strategic planning, but then from a basic level, if you're not doing much, or everybody's doing their own thing, maybe the teams or the case management teams could start to use something that, like an adaptation of this, that might work best. But like that's what I did, is actually they sent me a couple of the example forms. I looked at some of the documentation for some of the work that you do, and my mind was boggled how many questions were in the things that you have to ask people on. But I've helped people to do the mapping, and then they sort of try to do some modest attempt at streamlining it, and people have had some good success with that.
Thank you. That's helpful.
I like that a lot. One thing that, yeah, Peggy, thanks for bringing up the complexity associated with assessments. In the beginning, there's a story to be told about case management and the essential 3 components that agencies felt were necessary. And so, like, this goes back 30 years, to be quite honest with you, where intake, assessment, and then care planning were standards that were surfacing across the country. And there's never been standards of the profession or even ethics of the profession. And I'm really happy to say that along the 30 years, I've seen our case managers excel in both ethical development as well as the standards. You know, people were saying today that the care plan needs to be seen by the patient and the client. That's an incredible ethic that they hold on to dearly to make it happen so that they can feel it. But my point is that what I recently did is we're reviewing and revising the provider manual for case management, which is where those excerpts came from. And as I read it, my first impression too was, oh my God, the last read on this was 2017. Somebody's got to help us out a little bit, because these are really heavy, deep, and real aspects. And I love to leave some flexibility to both the agency and the case manager to develop, but we need consistencies, as you mentioned. So I allude in the new rewrite of the provider manual. Can't say I got rid of a lot of stuff, but you guys at the agency level, I'm going to send it to supervisors so you could take a look at it before it becomes but maybe this is our plea to action, that I do note TIA in 8 dimensions in the manual this year. And I suggest that we look at tools where we can enhance it. Didn't get to the template yet because it hadn't been formed, but I think that's a good way to start. So from our perspective, as the entity who funds the agencies, we can certainly assist by providing guidelines. But your point is really well taken about, whoa, I was definitely cross-eyed again too. I was reading the depth, and I can imagine the burden it has on people at the agency level.
Yeah. Oh, and if you need help with any of that mapping or anything, I'd be happy. And I think, maybe even a small group from here. This was a great dialogue here, and this piece of like seeing that you're doing a lot already, and then it's just opportunities to just streamline it. And okay, well, the last piece I wanted to highlight again in the present, we're coming to the getting close to the close. I'm just going to highlight a few other resources, and then we're going to just kind of talk about just sort of next steps, things you can do. I think we started some of this, but how do you, some of your next steps for leaving here today, and any of your takeaways or other resources you need. I wanted to just one of the things I did want to do, I did want to highlight is that, beyond the assessment, there's also resources and support. So I wanted to give you some more tools to this, that was part of it again, and related how the dimensions relate to the social determinants that I highlighted some of these challenges that you can provide. Housing services is something you're probably doing, employment and education, food insecurity, financial literacy, increasing health literacy in general. That's just a whole nother area. And then wellness coaching. That's something that some states offer, or, the tool that I just showed you is used in wellness coaching. So those are some types of supports and or resources. But I also wanted to highlight this other material for you and or just strategies, highlighting some of the strategies that you're probably doing already, right? These are, again, once we do it, and these are the main 4 areas again, but these are just different examples for as you start to drill down to some of the dimensions. And then, you can see food could be in the physical dimension, employment and occupational, housing example, environmental dimension, access to healthcare being in the physical, just strategies and approaches. These are things you're probably doing already with people, right? These are just a little bit of examples as we start to think, okay, we assess, but then what do we do if people have these needs? And then another thing I wanted to do just to kind of round us out is for resources. Again, there's the resources, but as another tool that you can use for clients or yourself. And I may have showed this. This is a brand new resource that I just developed that's called Journey to Wellness. It's a self-care tool. You can go online here, and it's in a flip book. And it's also downloadable, and it just gives you strategies around just thinking of your wellness in the 8 dimensions. It could be something you use as part of the assessment or part of the follow-up to help people, especially if they want to do, they want to sort of develop goals around just taking care of their recovery, about unplugging or connecting or sleeping or doing good. It's a nice little tool that, let me see if I can pop it up on the screen here for you. Is it up here on the screen now? Did somebody give me the heads up?
No, I think you might just be sharing your slides. So when you click
Okay,
on it.
I have to click back on it. Okay, now is it here? No, is it here? Can you see it now?
Yes.
Okay, great. So this is a tool. It's up here on this website, and you can, it's a tool, just a resource tool for people you serve, and addresses a bunch of the different dimensions. You can download, there's a full side version or a pocket version. And then there's also here, again, if you want to see how do I use this tool, I can use it with others. It gives you some tips for engaging others. This is for part of care planning, things you could do with people, resources you can get, or care planning. It also gives you guys, again, the point that was made before, tips for using yourself. It's a tool you could use yourself. And then if you do groups, it has tips for here. But I definitely want to show you this. This is, can you see this now? This here, the feature here, is it online? It's moving along, Anna?
Yeah.
Okay, good. So it's a nice little flip book, so you could even show it to people online and flip through it with them. And it'd be a nice tool around the 8 dimensions, or thinking about the different wellness areas. It might be a nice tool you could use to help people strengthen their different, you know, whatever the goal might be. It might just be a tool you can incorporate around some of the various dimensions. So it was just a resource. I like to show free resources that are accessible and online. That's what people like. They don't want to buy it. They want to, you know, if you print it out, it's going to cost the cost of your paper that you're printing, but otherwise it's a nice little tool here. And then it gives you a little note section. We talked about that. And then it also gives you a place to write your, you know, your daily actions. And we developed that tool, I want to let you know, with people who, people with mental health and substance use recovery. They developed it, co-developed and tested it with me. So it's been tested with people in recovery. It's been tested with providers, case managers. So it's a resource that's out there on that website that I wanted to just point out. As you do care planning, what are resources we can link people? We often do resources, we get the housing, we get the employment. Those are good goals too, the social determinant areas. But I wanted to highlight other resources that would be helpful around the various dimensions as tools. The other piece on that website I wanted to highlight for many of you as you think about, as we talked about, you know, your own wellness, right? Your own self-care. The other resource on this website for yourself, and again, it also might have stuff for clients that you might find, is there's a new section that's it's focused on the wellness of the workforce. So it's a toolkit where there's resources around individual things you can do. There's things for your organization. So if you're in leadership roles, or you can share this with your supervisors. And then there's what we call peer support resources, like how you can do informal peer support things in your workplaces. So it just gives like little, it's broken down, say, for example, it gives, you know, just different things around work-life balance, time management, health and wellness, stress. We actually had done a needs assessment of the workforce sort of here in the tri-state area. Was more New Jersey, New York, and Pennsylvania, but we just did a survey out, and that's how we got some data around what people felt was helpful. So there's nice resources. And then there's a learning collaborative where you can go to these sessions that they have. It's between now and there's 2 a month. They're all free online. So I wanted to highlight as a resource, that's more a resource for you. And, you know, clients might be interested in it as well, but definitely for you as a resource. So I definitely wanted to highlight that piece. And then again, on the website, go back to the inventory is there. And what I just showed you, this is all on the slide. So you'll get a copy of this. I wanted to highlight those there. That's the website I just showed it to you live, but it's on the PowerPoint. But again, the I becomes we, you know, illness becomes wellness. That's part of it. It's a we thing. So we definitely want to be together. I have lots of those resources I talked about, the social determinants of that. We didn't have enough time to go into that today because we wanted, these are other tools maybe for some of your assessment subdomains of the wellness areas, particularly around many of the unmet social determinant needs. I wanted to just make references and then a whole set of resources for you. So I, you know, we covered a lot today. We've looked at the self-assessment tools. We've gotten, I hope, a deeper understanding of the wellness for ourselves and for the people we worked and how it fits into assessment and then care planning. And now you know a few more resources at your fingertips that you can access that are on websites or resources in the materials I provided. So definitely want to hear from you any, you know, your questions or Paul, kind of your next step, Paul, or takeaways that we can continue to help strengthen integrating understanding and assessment and care planning in AD. Paul or Marianne or anyone want to, you know, any thoughts you have as we start to wind down?
Well, I think definitely I would like to help facilitate the mapping process if folks are open to it, to look at what we have and how we might improve. Deosha, I think we can probably incorporate a lot of this in training, future case manager training. Certainly, I can't wait to look at the resources, Peggy, and see how we can utilize these resources in our work. And maybe in our agency quality improvement teams, we can look at how can we improve the assessment process, how can we improve the care planning process, and incorporate a lot of what we learned today to improve those processes. Because we have set a goal this year to improve assessment. Any other ideas, guys? Does that sound okay, Peggy?
Yeah, I just wrote it down, mapping and integrate into case management, and mapping, then integrate into the training, use the resources, and then the QI. Excellent. Yeah, I think we wanted to spend a little time this last few minutes of seeing what people see as some of the next steps or questions you have or takeaways that you have, that, you know, some concrete steps.
Hi, I would definitely like to kind of just reevaluate my care planning and how I approach things, and try to incorporate the 8 dimensions in it a little more, you know, appropriately instead of just abstract. You know, make sure I'm hitting these points instead of just, you know, getting around them.
Yeah.
So a little more structure within my care planning based off the 8 dimensions.
Yeah, excellent. So some structure to the care planning. Excellent.
I like that a lot. I think one, too, all of you to keep in mind while I've got you all in the same place is the fact that we can always couple these, and we'll work with DEOSHA as the new facilitator of the Consumer Advisory Board, some broader based training for the consumers so that they're hearing these messages in different ways. We've done that to a certain extent with some of the training modules we've developed for consumers in aging. Like there's a financial piece, right? There's a diet piece, but to really bring that message home in ways that help reinforce what you just said, Dalen. You know, that if you're restructuring and rethinking about this, that the clients can have exposure as well. So you can give them something to take home, like that little booklet. And Peggy, I do believe that Manase was talking about putting that flip book into the TaviRed app and creating some quests for wellness. So again, reinforcing the consumers while you're reinforcing it in the care planning process, I think are all really laudable.
Yeah. Excellent. So yeah, integrating these resources, helping to you know, just see where the spaces it fits into it, you know, definitely. You know, I know we've done a lot today. It's a long morning, but it's been some really good work, and it's just so great to see how that, you know, you're already doing a lot of it too. That's the nice thing. Again, it's building from those strengths of, like, you know, you're already doing something already. That's the check off, you know, and then where can we notch it up a tiny bit here and there? Great. Any other questions or comments about the next steps for you, or in the chat? We'd love to hear anything you take. What's your greatest takeaway from today? Like, just be nice to hear. I see we have about 24 of us here, but in the chat, like, what is your greatest takeaway, or what is your next step? It might be nice to hear. I know it's hard to call on everyone and hear everybody, and everyone might be getting ready to shift into your break or your next Zoom meeting. Hopefully you'll have a little break between. You know, in the chat, what is it you're taking away? New perspective on care planning. Thank you, Dalen. That's great to hear. We like to just hear from everyone. What are you taking away, or what is your next step for today? Love to hear that, and then we can take the collective feedback and share it with everyone. Or if you have a question that wasn't answered, please put it in the chat so we can make sure we answer your questions today. Yeah, wellness is for the workforce and the clients and people we serve. It's a we thing. It's for all of us. We can all benefit. It's just more than ever, we know it's just so important to shine that light on the dimensions and keep it in our face. Yeah. Empower others rather than to tell them what to do. Yeah, like that's what we can, because then people don't, well, you know, not going to follow through, or it was your idea and it didn't work. But really helping to empower others is in peace. And that's what the wellness model really helps you to do, is empower others to self-direct their own plan. And again, that would be a really big piece, is to make sure everybody does have their plan, or co-create. There's a lot of work around signing of the plans and everything. I know I work at the agency I work at in New Jersey. We provide housing to about 600 people around the state, and the staff have to do the notes with the person and sign off with them. And yeah, that was a great important thing. Can't help each others without ourselves. It's been informative. Meet everybody. Yeah, the greatest, you guys learn from each other so much. How the determinants of health are connected and impact each other. It's holistic. And we sometimes forget them on the intake and the assessment. Excellent. We'll also be sending out a evaluation. In that chat, we're going to put that, because we want your feedback. What was helpful? What could be more helpful? What do you need next time? How could we structure this to make it much more accessible to your learning needs? Please tell us those things. More focus on clients' well-being and celebrating their strengths. Yeah, that's definitely one. There's assessment. Please, yeah, take that time to take it, because then we know what can we offer for you. And we take all the feedback is taken very seriously to improve what's going to best meet your needs. But focusing on strengths, new form of case management, integrative case management. Yeah, so like that. Yeah, great new name to reinvigorate the great important work. I think case management gets sometimes such a gets so put to the side and everything, but we know, like, it's essential. And I know one of the things in New Jersey, I was involved with the certified community behavioral health clinics. A couple of agencies, I was helping them move to that. And there was a lot of resistance by the clinical staff initially. And because they were to integrate case managers, God forbid, into their program. Well, they did it. And you wouldn't believe how it took a couple months, but how valuable the doctors and the clinicians came to realize the benefit of the case managers over time. And then, but they were so resistant for some reason, but you do hidden work for so many people, and it's so valuable. So, I think we have to elevate the understanding of the case management work, and just highlight to people, like, again, you were saying before, people really rely on you, and you are that social support. So you're really improving the quality of people's life and influencing their lifespan in a big way. Okay, anything else, Anna or Aisha or Paul or Marianne, before we end today? I think this has been, hopefully we accomplished the goals of the session, and it's been a really great to meet with everyone.
Thank you, Peggy. I think it was awesome.
Yeah, this was great, Peggy. Thanks for your time and effort. I really appreciate it. I think all of you on the call now, whether you realize it or not, are now soldiers related to the effort. And I'm going to need your help to really bring this forward in different ways. And as I mentioned, the provider manual is being tweaked for case management. So I'm going to hand it off to your supervisors so they can give me some valuable information, but I would expect that they can talk to you about ways that we could do a better job at creating a more integrative and functional approach to case management by using 8D, as well as some of the trauma stuff that we've talked about before. And anything else, I think this is the time to really change it up so that it not only benefits the people that you serve, but to the note that we've been hearing all this while, you can't be anything to your clients unless you're something to yourself.
Mm-hmm. Yeah. Yeah, putting that oxygen mask on yourself, taking care of yourself, people, you know, I think it's just so incredibly important for you all to just your own, and I'll send that self-care plan. You'll get the access to the resources, you'll get the PowerPoints, you're gonna get everything. And you just have to you just go click it on resource you need more. I also do a regular newsletter. I'll forward the newsletter. We just released the August. If you want to get on the if you want to get on the mailing list of getting like a newsletter that goes over like different wellness things for each month and everything, just to keep the spirit of wellness alive in, you know, different ways. But I'm happy to share any resources, and I appreciate the opportunity to present with you today. So we'll give everyone back their 10 minutes of their wellness moments for themselves, and take that break and get your coffee, or get ready for lunch, or take that a little bit of a break you need for the day.
Thank you.